When the question became, what were we going to call this new institute? William Julius Wilson immediately came to our mind. What a force he has been in the current thinking about poverty in this country. And he's had such a distinguished career, and we're going to hear from Bill Wilson. But I have to just read you some of the things that he is associated with. He's the Louis P. and Linda L. Geiser University professor at Harvard. He's been elected to the National Academy of Sciences, the American Academy of Arts and Sciences. He's won the MacArthur Award. He's written, just tons of books, and two of them, When Work Disappears and when the Truly Disadvantaged, really changed my way of thinking about poverty. So it wouldn't be our first conference if we didn't have a chance to actually hear from one of the great intellectuals and great professors in this country, Bill Wilson.
My name is William Julius Wilson, and I am the Geiser University Professor Emeritus at Harvard University. I'm proud to say that a new institute has been created at the Harlem Children's Zone in my name, the William Julius Wilson Institute. Last year, the Harlem Children's Zone successfully designed and implemented a 5-phase emergency response and recovery plan to address the proliferation of COVID-19 cases in Harlem. And the William Julius Wilson Institute is currently scaling the program with partners in 6 cities where Black people are disproportionately affected by COVID-19. I'll return to this important initiative after some brief remarks about poverty in place. In some Black neighborhoods, the disadvantages of ghetto life over multiple generations are reflected in growing physical and social isolation. Indeed, what cities like Baltimore, Milwaukee, Chicago, St. Louis, and Detroit have in common is that they feature Black neighborhoods that have undergone significant depopulation in the last several decades. This depopulation makes it more difficult to sustain basic institutions or to achieve adequate levels of neighborhood social organization. Facing notable levels of disinvestment, these depopulated neighborhoods offer few jobs and typically lack basic services and amenities such as banks, grocery stores, and supermarkets and other retail establishments, as well as parks and quality transit. Two of the marks or symbols of these depopulated areas are abandoned buildings and vacant lots. All of these changes have had a profound effect on the social organization of these neighborhoods, resulting in a weak institutional resource base. It is difficult for parents to control the behavior of the children in their neighborhoods when the links between community institutions, such as churches, schools, political organizations, businesses, and civic clubs are weak or insecure. Also, children born in these poor neighborhoods, these poor depopulated neighborhoods, are likely to have dramatically worse physical and mental health problems and other adverse outcomes related to chronic economic subordination and racial segregation. 3 of the 6 cities involved in the William Julius Wilson Institute's program to address the spread of COVID-19 among African Americans, Chicago, Detroit, and Newark, have been the sites of depopulated Black neighborhoods for decades. Indeed, these cities represent some of the most serious forms of depopulation in the United States, with an overall decline in population and relatively low proportions of new immigrants. Whereas depopulation is a characteristic feature of many low-income Black neighborhoods, some traditionally poor Black neighborhoods in cities like New York and Boston have become especially densely populated. And many families have had to cope with the hazards of pollution and growing congestion, including respiratory problems such as asthma and other health outcomes. It is important to note that in both depopulated and highly populated, traditionally poor Black neighborhoods, social and physical constraints impact the range of personal agency individuals and families can deploy. Indeed, personal agency is expanded or inhibited by the daily circumstances the poor confront, including interactions in social networks and institutions in distressed neighborhoods. Accordingly, when an organization such as the Harlem Children's Zone works to enhance equality of life chances in poor urban neighborhoods, it is providing conditions that also expand the exercise of personal agency to confront adversity. Most recently, this includes the work of the Harlem Children's Zone's William Julius Wilson Institute to help the residents of poor neighborhoods handle the spread of COVID-19, including emergency relief, assistance in bridging the digital divide, and mitigating the growing mental health crisis. Thank you.